All right, I did a post today on early access to postpartum care that we're still talking about, that 6-week visit. And I've had a lot of feedback on it. I had a colleague reach out to me and she's like, we can't do that in our facility because we need a referral and we have some doctors that won't write the referral early. And she's like, I don't understand this. And so logistics behind all this. If you are in the States, insurance trumps direct access laws. So in all 50 states, there's some degree of direct access to physical therapy. Virginia, DC, and Maryland now, and Virginia is just as of like July 1st. It's 100% direct access. You can see a physical therapist directly without a physician's order. You can, like, anytime. It used to be a limited number of visits, and now it's anytime. But here's the thing, if you're seeing a provider in a large healthcare facility, typically they're going to require a physician's order because insurance companies, a lot of them still require physician's orders. And if you don't provide them, then the insurance company won't reimburse the facility. So yet again, you have insurance companies driving the bus as far as care goes. And then if you have a physician that's like, oh no, I don't believe in early access, even though there's a boatload of evidence and ACOG, oh, I don't know, 2018 was like, hey, early access to postpartum care, you still have these barriers that are up, which is ridiculous. So because I went out on my own here, I guess 5.5 years ago now, it's nothing that I've really had to navigate, and I was in DC before that, and where I was, we navigated direct access within a hospital system, but it took a lot. So, I mean, let me just give you an example. I have a client that I'm seeing tomorrow, and I saw her all during her pregnancy. Typically, I will set up postpartum visits between 3 to 4 weeks from the due date. She was a little bit late, so she's like, hey, I first kid can't get out of the house. I'm like, totally fine, telehealth visit. Like, I remember being like 2 weeks postpartum with my oldest. We're hiding from the cleaners. So my kids are in my office and I'm hiding, by the way. I remember it was a hot mess. I didn't fit in any shoes. I had to wear slippers to my first pediatrician visit. Like, I'm pretty sure we were late. Like, there was just so much going on. And to be able to sit in my own house and get care would have been a freaking godsend. And I don't know why it's so hard, A, to get this, B, to like drop some of these stupid barriers. And the barriers are insurance companies and out-of-date providers. And again, I would love to provide the education. I would love to do that. But until we advocate for care being driven by providers that understand the evidence, like U.S. healthcare, it's a trip and a half. And I was talking to she goes by Paulina Baboa, and she's in Germany, and she's going to be on the podcast in a couple of weeks. And she was talking about how, like, Germany just trying to get regular care, and there's this, in just like decent early legitimate care, and just care period. And that's the thing, we here in the States, we're like, oh, it's better in the UK, it's better overseas. No, it's not. Physical therapists are diploma trained, and then BS, and then master's, and then doctoral level, whereas here we're all doctoral level trained for the most part, unless you were my generation. I went on and got my doctorate. We have access to direct care. Our biggest barrier here is not the providers and knowledge base. I mean, we've got telehealth, we've got virtual consults, we've got all this stuff. The biggest barrier to care is insurance dictating care. And it kind of makes me sick. And then it's also education. Why are we still, I don't know, 5-6 years after ACOG came out with their guidelines saying, hey, early access to care, 2 to 3 weeks in postpartum, with physicians, with physios, why do I still have moms that are 2-3 weeks postpartum and haven't seen their provider yet? And I'm not talking me, I'm talking their OB. Like, come on, people, like, this isn't hard. It really isn't hard. pick up the phone, telehealth. Like, we've got a lot of ways of accessing moms earlier. And I think the more as moms we demand this kind of care from our providers, that's where the wave of change comes. Like, I'm one person, but if I can influence you to ask for this from your provider, ask from your legislator to impact, insurance companies and that kind of stuff, like, that's how this wave of change goes. But there's absolutely zero reason. Sorry, we keep getting notifications. We've got a gigantic storm coming, and they're like, bah, guard your loins. Anyway, if we can continue this wave and push for early postpartum care, education and pregnancy, all that stuff, I think so much is going to change. But the hard part is the people who are impacted are the women in childbearing years, that we don't have a lot of time for that. So you have to put your money where your mouth is. You have to, talk to your provider and say, hey, this is what I need, this is what I demand, and I need you to change this. This is just a short window that we can make that impact while we're in that phase. Otherwise, you consciously have to, kind of look back and pull the women forward behind you, or pull those providers forward, which is why it's so important to me to educate providers and moms and that sort of thing early and often. So I would love to know, when was your first postpartum visit, not only with an OBGYN, but also if you saw a pelvic floor PT, what's the earliest that you were able to get in? Because I have a feeling that the wave is coming, but I would just be super curious to know kind of what that percentage is for you guys. So let me know, early access, when did you get to see somebody, and who was that? Good stuff. All right, be safe.